Now let's get serious. Imagine you or some friends are taking a walk through the park and you suddenly see somebody lying on the ground. You guys are all confused. You look around and see if anybody else notices this person lying down. You look around and they also seem confused. You go up to the person lying on the ground and check if they're okay. They don't seem to be responding, so you call 911. But by the time they get there, it's too late. Imagine if you could have been the one to know CPR and save their life. Today, I'm talking about something that should be essential for everybody to learn: CPR. Today, I'll be going through the materials you'll need, a step-by-step process, and how this is beneficial to you and society. Now, let's go over some materials. Obviously, you're going to need your hands, a little bit of strength, and an AED if it is available. Now, if this were the case of an EMT worker or a hospital worker, they would also have medications that will help, as well as a mask with a one-way valve and a bag attachment. Now, according to Red Cross, here are 7 steps that are essential to CPR. Step 1 is the one most needed. You're going to want to check your surroundings. If a victim has a gunshot wound, 1 injured is better than 2. Step 2, you're going to want to check if they're responding. You're going to ask them, "Are you okay?" Tap them on the shoulder. If they do not seem to answer, you're going to put your ear up next to their mouth and look down their body towards their feet. This ensures that you can hear their breathing or you can see their chest rising and falling. Next, you're going to want to check the pulse. You're going to take your index finger and your middle finger, and you can place it on your forearm at the base of your thumb where you can feel a pulse, or you can take those same fingers and place it under the jawline right next to the windpipe where your carotid artery is located. You will have a better chance of getting a pulse from the neck rather than the wrist. Now, if they don't seem to be responding, step 3, you're going to want to call 911. If a bystander is near, have them call 911 and talk to the operator as you perform the CPR. At this time, also, if it were available, you would want to get the AED. They are available in most public locations and most parks as well. Now, step 4, you want to make sure they're lying flat on their back. And now, step 5 is where we'll start the CPR. You're going to want to administer 30 compressions using your hands and the strength that I mentioned earlier. You're going to start by interlocking your fingers, and you want to place at the center of their chest where your elbows are locked. You will not be using your palm or your fingers. You'll be using only the heel of your hand. Now you're going to want to press down about 2 inches and give 30 compressions and counting out loud. 1, 2, 3, 4, 5. You want to continue until you get to 30. And then if this were the occasion that somebody had been choking on something and passed out, you would not be giving breaths at this time. You would continue doing chest compressions at 100 to 120 per minute to the rhythm of Staying Alive by the Bee Gees. Now, step 6. This is where you would give 2 breaths. In the occasion where you do not have all these kind of materials, you would pinch their nose and tilt their head back, and placing your mouth around theirs to make a seal. You would take a big breath in and transfer it into the victim until you see the chest rise and fall. After the 2 breaths, if the chest does not seem to rise and fall, that would be acknowledgement of an obstructed airway. If it were an EMT worker, they would take this mask, make a seal around the bottom, lift their chin, and blow into this. And then you'll see the chest rise and fall. At least give 1 second in between each breath and let the chest return to its normal stage before giving the next breath. Now, step 7. You're going to continue repeating these until help arrives, they come back, or if an AED is available. Once you turn on the AED, it usually walks you through the steps on where to place the pads, and it even usually comes with pictures on them. It will even tell you when the shock is administered and when to step clear of the victim. If you are touching the victim, you could have a chance of being shocked yourself, as it could be transferred through your body. For child CPR, you're going to basically want to follow all these same steps, except you're only going to push down about 1/3 to 1/2 of their chest, which is about 1 inch to 1.5 inches, depending on their size. Now, let's go over how this is beneficial to you in society. CPR saves lives. According to the CDC, 9 out of 10 people who have cardiac arrest outside the hospital die. If you don't know what cardiac arrest is, it's when your heart stops beating. The CDC also states that CPR can double or even triple the chance of survival. But did you know that CPR can also reduce brain death? According to Avive Life, after 3 minutes of cardiac arrest, your brain has already had significant damage. But after 9 minutes, it can have irreversible damage. Now let's go over what we talked about. We talked about materials you need to do CPR, how to do it, and how this benefits you in society. I strongly encourage every one of you to go out and take a class and get certified. But just remember, you could be somebody's second chance at life. Thank you.